Welcome to the Nourish and Flourish podcast series, where we will bring in different health and lifestyle related topics to you in simple and actionable way. I am Raja Mitra, a technologist from San Jose, California. A quick disclaimer for medical legal reasons. Any of my notes, comments, suggestions should not be considered as a medical advice or consultation in any form. Also, as of now, none of my quotes or references are commercially funded. Today's topic is an overview of cholesterol and associated diseases. Do you know that ApoB and LpA are the most important tests for cholesterol and associated heart diseases? Do you know that beyond statins, there are good alternatives to cholesterol lowering drugs? We'll be covering this today. To ensure that the topic is relevant, here are a few statistics. Heart diseases are the number one cause of medical deaths. About 1 in 3 deaths from coronary heart diseases is directly due to high cholesterol. About 40% of the adults around the world has abnormal cholesterol. This is mostly attributed to poor lifestyle and dietary choices. The good thing is, significant portion of these cases are preventable and manageable. So it makes sense to have a working knowledge on this, rather than only be driven by what you can loosely understand through your physician. What is cholesterol? To understand cholesterol, we need to first discuss what is a lipoprotein. The term lipoprotein contains the word lipid and protein, and lipid means fat. So, lipoprotein is a spherical protein particle that transport different forms of lipids like cholesterol and triglyceride. Cholesterol and triglycerides are fat that are essential to human body, but too much of it can cause problems, like contributing to clogged arteries by forming plaques and raising the risk of heart problems. Imagine your blood is like a river flowing through your body with cargo boats called lipoproteins that carries cholesterol, triglyceride, and similar lipids. If there are too many low-density lipoprotein cargo boats in your blood, cholesterol from these boats can stick to the walls of your blood vessels and making the river narrower and harder for blood to flow smoothly. So there is nothing like good cholesterol and bad cholesterol, but good and bad lipoproteins. You may have already heard about common lipoproteins like LDL, VLDL, HDL, etc., and their recommended ranges. What is lesser known and very important are lipoprotein A or LPA and apolipoprotein B or ApoB. We will have a follow-up session podcast on this called 104, Cholesterol and Lipoprotein. There we will discuss on different types of lipoproteins and their role. So, having discussed what cholesterol and lipoprotein are and that the excess of these are bad, what kind of diseases are we looking at? First, a group of cardiovascular diseases like CAD, PAD, and aortic stenosis. CAD or coronary artery disease is where the arteries bringing blood to the heart are fully partially blocked. PAD or peripheral artery disease is where the arteries that take blood away from the heart are blocked. Aortic stenosis is where the aortic valve of the heart are blocked. Then there are neurovascular diseases where blood vessels in your brain get impacted, what we refer as stroke. Not surprisingly, besides potentially impacting heart, brain, and arteries, high level of cholesterol in the blood can impact diabetes as well as high blood pressure. So, we talked about cholesterol and associated diseases. Question is what kind of testing we should be doing. In order of importance, it is ApoB, triglyceride, LPA, and HDL. Other tests are good to have. Unfortunately, many medical practitioners guide the decades-old methodology of testing LDL, HDL, total cholesterol, LDL, HDL ratio only, and ignore ApoB and LpA. We will have a follow-up session podcast on this called 102 cholesterol testing. There can be other kind of testing like calcium or PET or MRI scans or electrocardiogram. These are advised based on the risk assessment. Given that a person has abnormal level of these lipoproteins, let's talk about medication. The common trap is to think unscientifically and get advised on lowering it through natural means only. This often delays the treatment and in most cases is ineffective in bringing the results to the desired level. The most common frontline drugs are statins. There are many kinds of statins. Front runners are atorvastatin, also called Lipitor, and rosuvastatin, also called Crestor. Beyond statin, people may need other drugs like PCSK9 inhibitors, that is injectable, or bempedoic acid. We will have a follow-up session podcast on this called 103 cholesterol lowering medication. The motivation of this talk is not to make you get lost in terminologies or discuss complex scientific topics. However, it makes sense to take charge of your health and life and be educated so that you take informed decision at every stages. So, we come to the last section where we discuss what to do and not do. The first principle is what you can measure, you can control. So, at least make sure your doctor guides you to measure ApoB, triglyceride, LPA, and HDL. Do not be fearful or apprehensive of taking the prescribed medicines. These are extremely safe and effective. In fact, in order of importance, the ranking could be medication first, then diet, then sleep, and then exercise. We already talked about medication choices. In terms of diet, rather than getting into the fad of different types of diets and their merits and demerits, stick to the basics. Have less caloric but nutrient-dense food as a lifestyle practice. If you do not understand this, eat less frequently, in less quantity, with minimal sugar, salt, saturated oil, and fat, and processed food. I cannot emphasize more the importance of consistent, good quality sleep. This means noise and light-free ambience with right temperature, and with at least 6+ hours of quality sleep daily. Incorporate simple exercises like walking after meals and some squats daily, and then gradually build up stamina, strength, and flexibility over time. Avoid or completely drop smoking and alcohol. Remember, no amount of alcohol is good for your body. This concludes today's session. We will have more podcasts like this to educate ourselves, nourish, and flourish. Stay tuned. If you like this podcast, would appreciate you clicking the like button and subscribe to the channel.